Welcome, everybody. Thank you for joining us. We're going to be discussing insights from Title V on partnering with federally funded programs, and this webinar is sponsored by the Children's Safety Network. The Children's Safety Network is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Child and Adolescent Injury and Violence Prevention Resource Centers Cooperative Agreement. This information or the content and conclusions are those of the author, and they should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. I'm now going to hand this slide over to Jenny Stern-Carasone before I introduce our speakers so that she can go over some technical tips with you.
Hello, welcome everyone. A few technical tips today is that if you are unable to join audio or having difficulty with your computer audio, you are able to join by phone. All participants are muted, but you can submit questions throughout the event utilizing the Q&A button at the bottom of your screen, and we will address those questions in the discussion portion of our webinar later on. And we will be sharing our resources, recording, and slides within the next 2 weeks, posted on our website for you to access as well. Back to you, Jennifer.
Thank you, Jenny. I'm Jennifer Leonardo, and I am the Director of the Children's Safety Network and the Interim Director of the Children's Safety Now Alliance. I'm very happy to be introducing our panel of speakers today. But before I do that, I'll tell you a little more about Children's Safety Network. Our panel of speakers are going to be representing two of these areas on the slide that you see in front of you. Two of them are members of our National Alliance, and all of them have participated in one of our learning collaboratives. At CSN, our mission is to ensure that all children are happy and healthy in the United States, in Washington, D.C., and across all of our jurisdictions. We work to advance child safety in order to reduce injuries and fatalities that are injury and violence related among children who are infants to age 19. Today, we are going to spend time defining Title V federally funded partnerships. We're going to define what we mean by partnership and how we align with partners. We're going to provide examples from the field. You'll have a chance to hear from all of our presenters, panelists, and then ask them questions of your own. Then we will share out some resources with you. What is Title V? Title V is a federal block grant that was established in 1935 to create federal and state partnerships to address health service needs of mothers, infants, and children. It is funded by the Health Resources and Services Administration, Maternal and Child Health Bureau. States apply annually for these funds and proportionally match them. The grant amount that is awarded is based on the state's population size and their need, and this is available for all 50 states and 9 jurisdictions who are all funded. In 2023, the Title V Maternal and Child Health Services Block Grant helped provide services for an estimated 59 million people, including 94% of all pregnant women, 98% of infants, and 59% of children nationwide, including children with special healthcare needs. Title V agencies work in injury and violence prevention across our nation to address a broad range of topics across various populations. They are committed to increasing reach and achieving impact, and they do this across topics such as fire and burn prevention, suicide and self-harm prevention, drowning prevention. And you can look at all of these areas at the Children's Safety Network website, and you can also find them on HRSA's website. We also know that while Title V is doing all of this wonderful, broad, and deep work, there are challenges that are being faced, and those often have to do with funding and with staffing. This is why it is critical that we have this discussion today to talk about how Title V can work to establish and leverage partnerships to address these challenges and to reach infants and children and adolescents in our country. So let's talk a bit about partnerships. Partnering can take on many different forms. It can look like data sharing to facilitate data-driven decision making, communicating complex public health information, developing and testing interventions, and sharing data for various audiences. We often talk about SMART aims. SMART aims help to organize our partners, and they help us to keep focused on intended outcomes. When we talk about what we want to achieve, we ask all of our partners to be very specific, to have measurable aims, to have aims that are going to be attainable. They have to be relevant and time bound. This helps everybody to stay on track and aligned throughout the partnership. We want to assess potential partners, and this is a tool that we use to do this. We first clarify our goals, and we clarify the population that we are trying to reach. We can ask, what is the age? Where are they geographically located? What is going to be the child safety topic that we want to be addressing? We then identify any gaps. Where are we going to come together with these partners to be able to fill these gaps? We brainstorm who the partners are going to be. How are we going to reach our priority populations? Who has the needed resources to do this? What are the related outcomes that all the partners are working toward? Are we working on similar risk and protective factors? And do we have a vision or mission that overlaps? Then we look for cross-department partnerships, both within our agencies and across state and local agencies. We also consider state coalitions and other organizations that receive federal funding. We are scanning the landscape to see who all the potential partners are and how we can most effectively work together. This is a partner analysis tool that we ask the Title V agencies who participate in our Child Safety Learning Collaborative to go through. And you can see here that it's addressing what I mentioned in the previous slide, identifying your gap, your potential partners, asking how can each partner fill the gap? What is the value of the partnership? What is the commitment that we're asking each partner to bring? Who is the best person to make the request of the partner and why? Do they have an established relationship? Is there an area of work that they're overlapping in? And also, what are the next steps? Once we reach out to the partners, how do we make sure that we have a well-intentioned plan with this partner? We also know that partnerships take on many different levels of collaboration. They can be very informal and they can be extremely formal with written agreements. If we look over on the left-hand side of this slide, we're looking at a level of partnership networking that is more informal. This is where partners are sharing information and talking with one another for mutual benefit. There are loosely defined roles. There's more flexible relationships and informal communication taking place. Typically minimal decision-making and low risk. A higher level of partnership would be cooperation, where partners are supporting one another's activities, but there isn't a formal agreement in place. There are somewhat defined roles, informal and supportive relationships. There would be more frequent communication than with the networking, but there's still limited decision-making that is taking place, and it's relative low risk. If you start to become more established in a formal manner, you may have coordination. This is where partners are engaged in mutual projects and initiatives. They may modify their own activities to benefit the whole vision. There are more defined roles. There are formalized links, but every group is still retaining a level of autonomy. You have more regular communication taking place and shared decision-making around joint work. There are often decision-making processes that are being followed and that are well known. There's still low to moderate risk, and you're sharing some of your resources. Then you have a level of collaboration that is much more formal, and this is where you're going to have an agreement in place. Your partners are working toward developing enhanced capacity to achieve their shared vision, and they're going to formalize what each person is doing. What is your role? What are your formal links? How are you going to be communicating with one another? And you're going to be typically writing this out. It could look like a memorandum of understanding or a memorandum of agreement between your partners. Your communication is frequent, it's well known, your communication channels are established. You have equally shared ideas and decision making, and there is a higher risk typically, but you have a higher level of trust with these partners and protections in place with your formal agreement. You're also oftentimes pooling your resources. The take home message here is that relationships are key. For effective partnerships to take place, what we see is that the expectations need to be very clear. You have to have a shared vision. You have to know what the value of each of the partners is, what they're bringing to the table, and what gaps are being filled. There are often established communication styles and standards. There aren't a lot of surprises. People know what their role is, what they're expected to do. You identify all the different ways in which you can link and you can work together. You also determine how you're going to know that you're making progress. What will those process measures and outcome measures be that you'll be working to understand and to implement? You'll be asking, where are we pulling our data from? How are we going to be ensuring that we have all the connections in place, that we are communicating out to those who we are serving, and we are respecting the memorandum of understanding or the memorandum of agreement that we have in place. In solidifying our partnerships, we want to ensure that we gather and share opportunities. One way to do this is through funding applications, setting up regular meetings. You want to be able to have open discussions, be transparent in what the challenges are that you're facing. You also want to share the successes and the lessons learned so that we're not reinventing the wheel. You want to have a high level of trust in order to do this. And you want to maximize all of your opportunities so that you can be able to move from that networking to the more established and effective partnerships so that you can be cooperating, collaborating, and building off one another's work. So now I would like to be able to have us have a robust discussion with all of our presenters today. I want to thank all of them for joining us, and I'd like to take the time to go through some of their achievements and introduce them to you. So we have Peg Ogea Ginsburg, who is here with us. She is the Injury Prevention Program Manager for the Nebraska Department of Public Health and Human Services. She's also a Children's Safety Now Alliance member. Peg has over 35 years of experience in public health. She has held her role as IVP Program Manager for the past 20 years. She oversees CDC core SIP grants and the Rape Prevention and Education Grant. She's also a child passenger safety technician. She remains active in a number of partnerships and in Safe States Alliance. She served as Safe States Alliance Executive Committee as the Secretary, Member at Large, Vice President, and President. Thank you, Peg, for being here today. Next, I would like to introduce Jennifer Miller. She is the State Maternal and Child Health Title V Director at the Kansas Department of Health and Environment. Dr. Miller directs Title V block grant investments across her state and is responsible for drafting and implementing 5-year state action plans. She also serves as the Kansas Maternal Review, Kansas Perinatal Quality Collaborative, and Kansas Maternal Health Task Force. She's involved with the Association of Maternal and Child Health Programs, Legislative Affairs and Policy Committee, and the American Public Health Association. Thank you so much for being with us today, Jennifer. I'd like now to introduce Terry Love. Terry is the Injury Prevention Director at the Tennessee Department of Health. Terry is a community leader with over 25 years in community-based prevention. He's worked in multiple settings to develop leaders and motivate stakeholders to facilitate population-level change in schools, community, and statewide settings. Terry uses data evidence-based methods and policies. He's assisted many communities with identifying and mitigating root causes of behavioral health problems and implementing population-level strategies. Terry is also a member of the National Safe States Alliance Executive Board. He serves on the Safe States Alliance Special Interest Group and Safe States Policy Committee. He's also active in the Southeastern and Southwestern Regional Injury Prevention Networks and other Tennessee multi-sectoral injury prevention coalitions. Thank you, Terry, for joining us. And we also have Becky Majok. Becky is the Data to Action Team Lead for the Louisiana Department of Health, Office of Public Health, Bureau of Family Health. She's held this role since September of 2023. She leads teams who are responsible for analyzing data related to pregnancy, birth, violence and injury, and unexpected deaths to children and pregnant women. She makes recommendations to prevent injury and death, and she works through policy, systems, and communities. She partners to implement recommendations to prevent future injuries and deaths. She's been with the Bureau of Family Health, which administers Title V since 2013. She most recently served as a senior advisor and chief of staff to the director of the Bureau of Family Health. And she joined the Bureau of Family Health as a health education and communications manager. We want to thank you, Becky, for joining us today. So I hope everyone has a sense of the depth of experience that all of our presenters have in partnering and in working with Title V. So now we'd like to get into a discussion about effective partnerships, but I also want to provide a reminder that you should see in your Zoom icons there, I think at the bottom of the screen for most of you, the Q&A section. Please feel free as we're having this discussion to add in your own questions that we can also ask our presenters about. So we're going to start here with the first question. What defines an effective partnership between federally funded agencies? I'm going to invite our presenters to respond to this, and perhaps I will start with asking Jennifer for your thoughts. I think you're on mute, Jennifer.
Okay. Can you hear me now?
Yes.
Okay, perfect. I think for me, when I think about effective partnerships between those federally funded agencies, is really having an understanding of what the expectations are for each of the partners. I work with a lot of other grant funded agencies and even just with other grants across our organization. And a lot of them have very specific requirements and expectations of those grants and how they can invest those dollars. Whereas with my Title V funding, we have a lot more flexibility. So it kind of provides us a little bit more freedom to kind of engage with our partners in different ways. And I think so for me, it's just really setting those clear expectations, having an understanding of what each member is bringing to the table, as well as making sure that you're not there just to get what you need, but you're also there to help support the other organizations, your other partners with what they need. We're currently working on our new state action plan for Title V, and we'll be submitting that this July. And so one of the things that we've been real intentional at is we partnered with a lot of different organizations like local public libraries to host community events to get feedback from our general population. And so being intentional about how do we, now that we have this information, now that we've kind of started to draft this plan, how do we get that information back out to them so they have an understanding of what's happening with this information that they're sharing with us, and an idea of how we're going to use it, and the ability then to come back and say, like, that's not the right direction. Like, that's, like, it's not exactly what we were saying, or saying, like, yeah, I think this is a really great way to improve this specific aspect of health or not. And so that's kind of what I look at as being really important for those partnerships.
Thank you, Jennifer. And our other presenters, do you have some thoughts on what Jennifer is speaking to? Becky?
I can add.
Oh, Terry, excellent.
Yeah. I think one of the things when I think about partnerships is really commitment. Like commitment of your own commitment to the folks you're wanting to partner with. Relationships, I think you mentioned in your presentation, are key. That ability to quickly form relationships with folks, find ways that your goals align with their goals. Try to be a helpful person at first, and be somebody that people want to work with. Uh, and then, and that what happens is that reputation will precede you if you establish that reputation in the field. And then, I mean, the other thing is showing up, being where they are. If you're invited to a meeting, show up, participate, bring some value to the meeting, and share your talents. Again, looking for ways that how can I help you meet your goals? I mean, I will literally say that to them, and then we hopefully find some ways to help each other meet goals. And to me, I think that's kind of a basis. And the other thing is to I always try to say good things about people. When I'm talking to other people, gosh, Peg, if you've ever worked with Peg, she's great. And then or writing it down, letters of support, emails. Who's your supervisor? Let me email your supervisor and tell them how great you are. Those are the little things that you can do along the way that makes you a good partner, and then that helps you attract other good partners.
Yeah, Terry, you brought up some really good points there, especially with the partnerships and the relationship. It is so important to know what their goals are and understand, not always frame it from your perspective. So for us, we had issues over the years with Medicaid. We have to have a partnership with Medicaid in Title V. It's required. And we have to have an interagency agreement, but often we were speaking different languages and we weren't speaking the language of Medicaid when we'd go there for asks, and we thought that our public health language would be motivating to Medicaid, for example, and it didn't always work out that way. So when we finally kind of honed in on what to ask Medicaid about and how to frame it about beneficiaries and about quality improvement and value-based payment systems, it made it a lot easier to have those conversations and to have a more meaningful interagency agreement and work together more effectively. And then when you mentioned letters of support, oftentimes we get people to send us like a draft letter of support for a grant that they're applying for. And those letters of support they're very exaggerated, and we end up like pulling a lot of that language back, but then being really specific about what support we're going to provide. And we don't offer support that we cannot also do. So with the letters of support, sometimes they're asking, they put in something in there that it's not specific, or it sounds like a huge role and we don't have any staff to support it. So we go back and forth a little bit to figure out what our actual support's going to be. And yeah, so a letter of support may seem simple, and once you hone in on what that support is going to be, they are pretty quick to turn around, and it is a quick win for relationship building. But it also can backfire on you if you sign something that they send you and then can't fulfill the promises that you made in that letter when they get their funding.
That's a great point, Becky. I was going to refer that back to the SMART aims. When I'm hearing about the type of support, you're being really specific about what you're doing and intentional. It's something that's really attainable that could help folks and partners to really think through that support if they write that out in a smart way. Peg?
I just was going to say a lot of great points have already been made. I mean, I think simply it's like being at the table. And, as Jennifer mentioned, the partner tool is so helpful in looking at partnerships. And then just finding out what your shared goals are. Because, ultimately, we all have very similar goals. They might be somewhat different, but, we're all working toward the same giant goal in the end. And so if you can find out just what your shared goals are, I think that really helps to be more successful in a partnership.
That's great. Thank you. Wonderful points. So in looking at all these things that make up a partnership, I want you to talk a little bit about the key elements in your agencies, in your systems that you need in place in order to partner effectively with other federally funded programs in your state. What would those key success factors be, those key elements?
I think for me, I'm fortunate because in Tennessee, our block grant folks are in our division in the Department of Health. So, we have that kind of culture of partnership. There's not, we really work hard with our division and even our department to try to eliminate silos and it's kind of understood
Mhm.
that we're in this together and we are, there's there's an expectation of partnership, but then sometimes, you seize a moment and you go beyond the minimal expectations. And I think looking for those opportunities, for example, we um, had some very great work this year around firearm safety and safe storage. And we had the Be Smart program in Tennessee that was just kind of taking off, and I was able to help them kind of get on their feet. And then, lo and behold, one of our block grant folks wanted to, the evidence-based home visiting folks wanted to partner, and we trained a bunch of their evidence-based home visiting folks, and it worked out. And we did some data collection of the visitors, and it was positive, and then that translated to chant, and so things like that can grow if you're open to it, if you're open to the more partnership and then doing just a little bit of program evaluation along the way so you can share that with others and they can see that it's working. I mean, those are some key elements, I think, for us in terms of, like people have said before, establishing the partnership, making those connections. I'm a big connector of people. I'll there won't be long. Be talking to you and I'll say, oh, you need to meet so and so because they're doing this kind of work, and
Mhm.
then trying to connect those
Mhm.
people, connect those goals. And I love that prevention work that Jennifer's doing. That's the best primary prevention she can do right there as a good parent. But anyway, yeah, those are some things for us in Tennessee.
I think, again, being at the table. One example recently, our maternal child health just did their assessment. And so we're like, yes, we'll come. We'll come. How many of us can we bring? And, being able to have input. And then also, like our EPI was really helpful in that process too, with some of the data that was being used to help determine priorities. So being at the table and being helpful in whatever ways you can be. And then following through and, those kinds of things that Terry had said too.
I've also had experience, I think it's a combination too. So when you're thinking about key elements, if you're truly partnering with somebody, what I've experienced is it's not always in a formal way. Like the meetings are really important,
Mhm.
but when I have someone I really consider a partner, I can pick up the phone and ask them a quick question and they respond quickly. I can send them a text or send them a quick email and we respond to one another. We don't put each other off. We're priorities for one another. We share resources. Sometimes we ask about stuff that's outside of the project, because we know what each other's professional interests and goals and skills are. So it really is knowing your partner, knowing what
Mhm.
their other goals are, not outside of the work that you're doing together too, so that you can support one another. You can link each other to other resources. And I think that
Mhm.
that's how you can define a successful partnership as well, is how much you work together to make connections. Connections are big for me.
Becky, I love getting those texts at 3:30. Hey, I need this data point. I got to get this report done. Can you help me? And that's when you know you have a great partner right there. If they're able to text you and ask you that kind of question, that means you're not just a partner, you're friends, and these are lifelong friendships over time. So yeah, don't be afraid to make friends with your partners, and keep a sense of humor. And Becky's right. That those little nuggets are not on any chart. That kind of I can text that person at 8 o'clock at night and they'll get that data point for me, uh, or vice versa.
I hear a lot about the people skills, the leadership skills, and building relationships. And we'll get to talking about challenges, but I think this is pretty incredible given that oftentimes we hear of staffing challenges. And so creating this real culture and spirit around partnering, I'm hearing is extremely important. We have a question in the chat that I want to pose to you. We have Joanne Miles who's asking us, when writing the MCH block grant section about partnerships, do you ask your partners to write about their activities, submit a success story? And I'm going to post that for everyone to see.
I can start off with that. So we have a lot of our funding goes out through a process we call aid to local. So it goes out to local health departments, FQHCs. So a lot of times what we do with them is ask them to share those success stories with us. We also, within each of our domains, like to highlight their achievements. So if they have really increased the number of women they're seeing for well woman visits that year, like making sure that we highlight that in each of those specific population domains, just to really pay like homage to like this is the great work that they have done. um, and then we also tend to ask some of our like more statewide partners. So we have the Kansas Breastfeeding Coalition and the Kansas Infant Death and SIDS Network. And we ask both of them to help kind of write about some of those great achievements that they have made. And so that again, that we get to share that not only with our federal partners, but then throughout Kansas, as we post that on our Kansas Maternal Child Health website, as well as the Kansas Department of Health and Environment's website. So we really do try and give them the opportunity to share in their own words what they have achieved and make sure that they are really getting that recognition for the great work that they're doing. Because they are our boots on the ground folks, and only by them doing that work do we get to, at the state level, continue doing the work that we're doing to support them.
Yeah, I don't write as much of the block grant as I'm sure Jennifer does in her role, but I do review it and I look at the sections that are relevant to my team. And we have the State Systems Development Initiative under my team as well. And so when it comes to us working with partners that are federally funded or the federal government, a lot of the injury and violence work, it's braided with CDC funding as well, and then support through Title V. And we're more centralized in Louisiana than Kansas. I know you guys give most of your money to other people. We run most of our stuff in through our program. So we end up writing the sections mostly, but we do highlight partnerships, contractors, but we don't ask them to write those sections for us just because of how we're set up and our staff are managing those programs. So we ask the staff to get feedback and celebrate those wins. But you'll see Title V varies so much from state to state to state that you've seen one Title V program, you've seen one Title V program.
Thank you. I think we have another question I think that would fit well here. And it's asking, could you briefly talk about how your agencies are partnering with Title V grantees, whether they be public or private?
Well, I think we've discussed some of that already, with evidence-based home visiting and CHAN. But we weave our programs as we can into the block grant work. In the past, we've supported like local school districts have helped us with some of our work with our trying to reduce injury. We wrote injury into the block grant, just snippets of it with our Battle of the Belt contest program around the state, and trying to recruit schools to participate in seatbelt increase among their students, through a prescribed evidence-based program. So there you have a partnership both with the Title V folks and the school districts. We've trying to think of others with our ACEs work, developed and promoted videos to educate folks in the early days about adverse childhood experiences, provided those to, again, home visitors and others. But we're always on the lookout, and of course the block grant folks, I'm not a block grant funded person, but the block grant folks are always looking for ways that we can, help support the block grant through activities that may or may not be funded through other ways that we're doing anyway, right? I mean, just because we're funded under one grant, an injury in Tennessee doesn't mean we're going to ignore all other injury priorities that aren't funded. If anybody calls us, Peg will say the same thing. So anyone wants to call and talk about drowning, and even though you may not have a grant specifically for drowning prevention, you're going to try to work on it and try to find people who can help you. We had that conversation just recently. So with our Committee on Pediatric Emergency Care folks. So I think one of the things I would say is, if you are stuck in your building and you're not getting out to these other multi-sectoral groups in your in your state, like Committee on Pediatric Emergency Care, the Trauma Care Advisory Council, or if you're not involved in Injury Prevention Coalition or others, get outside of your comfort zone. Ask about those things in your state and join those groups, at least as a participant, to begin to learn, and then find ways to, connect with some of those folks, and or become the connector yourself. And that's ways I think that you can. I know I'm kind of rambling on about the question, but I think those are the ways that you establish these relationships, and you begin to figure out, how can I solve that problem?
I think one example of something that we did several years ago, the child passenger safety training runs through our program. We partner with Highway Safety to help pay for that and that kind of thing, but we organize it. And so we worked with our MCH people and got some of their home visitors trained. And for us, that felt like low-hanging fruit because, we've been doing the training for so long, but it was really helpful. And then also with, Terry mentioned ACEs, we tried to work with our home visiting program to do some ACEs work too. So those are just a couple examples where we tried to work not only with our internal maternal child health folks, but also some of the community members that they work with.
That's great, Peg. Continuing a little bit, Terry, you mentioned working with schools. We have another question from our viewers. What are some examples of Title V partnerships with school districts? Do we have a few others? I think you mentioned the Battle of the Belts.
Well, from Title V perspective, I know in Louisiana, our adolescent school health program is under our bureau. So we do actually, we've been looking at how do we partner even better with our adolescent school health program related to injury and violence prevention. They don't run, it's kind of weird how we have it set up in the state, but the schools, we have like 57 different schools that are agencies that run school-based health centers and schools that are supported with technical assistance from the state. And so we do like office hours and TA and provide that to the schools with which we have those relationships. But we're also part of the Adolescent School Health Initiative and School-Based Health Center Alliance in the state. So we are looking at ways to, I know we've talked about suicide prevention work in particular. We will be rolling out some of our, we did a study, our epidemiologists did a study related to like the timing of suicidal ideation and the school trimesters or the school year. And it's going to help us roll out some information to the school system before those time periods of high risk come out, so that the teachers know what to look for and the administrators know what to look for as far as risks and risk behaviors in the students, so that they could potentially notice if someone is at risk for suicidal ideation before they get to that high risk period. So there was a time period in the very beginning of the school year, and I think there was a time period, I probably am getting this wrong because I did not do the study. I've read a paper though. And there were 2 risk periods in the year that were it shoots through the roof, and it's not the times that you would just automatically think of. So we're using that together. I know that's not the only, that's a very specific example, but
yeah, our Essence data, Becky, and great work, by the way. I wonder where you guys were doing that too. Our Essence weekly Essence reports that, the first school is hard on kids. Starting school in the fall and starting school in the spring, those are high risk times for kids for suicidal ideation and or attempts. That's what our Essence stated. So Essence alerts is one way we're partnering with schools. We've tried to explore this year with our planning for the next go around. We have a sports injury prevention program called the Safe Stars program, Safe Stars Initiative, and it's a reward program for schools who adopt policies and practices to reduce sports injury. But a part of that is social emotional learning, right? So adolescent mental health. If the coaches sign off to abide by our coaches' creed or our coaches' code of conduct, which would encourage better, essentially, without getting into too much detail, be a good person as a coach and practice all those kinds of psychologically safe methods of coaching. Then we're exploring documenting that as part of contributing to better adolescent mental health. So every time a school is recognized at the bronze level, and if coaches have signed those codes of conduct, then we're going to document that as a progress towards adolescent mental health. Does that help? I hope that helps whoever asked the question. I can't see the questionnaire, so I don't know if I'm on the right track. But you can be creative. The good thing about block grants is you can be fairly creative about how to reach your goals, and so that's one way we're exploring right now, and that impacts. Right now, 77 schools have completed this pretty robust application, and all those thousands or hundreds of coaches in those systems, which is districts, have signed that coaches code of conduct, and we anticipate, more schools each year. So I hope that helps answer some of the folks. And you can email me later, and we'll talk for hours about it if you want to.
That's great. We had another specific partnering question, which was about how you're partnering with Title 10, which is family planning. Do we have any examples of that?
That's a little bit out of my bailiwick in injury prevention, so no, I don't personally. But
I mean, I typed my answer in the chat. We administer Title 10 and Title 5, so we automatically partner with them, and we fund some of Title 10 with or some of the efforts for reproductive health with our Title 5 funding in Louisiana. So it's not necessarily a good example because we are both.
Great.
Yeah.
Well, we're going to keep moving on with these questions. So we've heard a lot about some great successful partnerships, but I want to turn the conversation to asking about common challenges that you face in your partnerships and how you address them.
When we were practicing, we had a good time with this one because I think we all have similar challenges. We're all in government. All the federal partners and that we work with are also in government, so you experience a lot. I know we all said stuff about just government bureaucracy, levels of approval, and things like that. So are there any specifics anybody wanted to throw out there?
that could be a whole webinar, Becky. But I think one of the challenges, like you said, we all experience is government wants to be safe, right? Everybody wants everything to be safe, and that's why there's so many levels of approval and another form. Every time something goes wrong, there's another form to complete, and it seems to be a never-ending process. And so, contract approval for us takes a long time, and I know it probably does for other states. And that's something I would like to see reformed someday. I think one of the challenges mentioned before is just spreading myself too thin, because I want to have my fingers in everything and I want to be involved in everything. And I have to be careful not to spread myself too thin and then not to overpromise and then make myself really stressed. I would encourage people to be careful with that, just on a personal care level. Those are two challenges. And of course, right now we're in a really difficult time. And so keeping partners motivated and or, in the work, because I think people right now because there's so much uncertainty that we're not used to experiencing this kind of uncertainty in this field necessarily, other than, every grant cycle you're uncertain, but the uncertainty now is on a different level. So keeping partners engaged and keeping spirits up is another challenge today. Hopefully that'll abate soon, and we can begin to know more what the landscape's going to look like.
I think one of the challenges or another challenge is just finding common ground when a lot of times the funding is very siloed. You know, we're funded by CDC, and at least in the past, it's always been somewhat prescriptive. And, what we're charged to do may not be the same as what some other partners are charged to do. So you really have to be sure that you can find that common ground. Because, ultimately, like I said earlier, our ultimate goals are the same, but it could be that, you have very specific deliverables that you have to meet for your grant, which may or may not match some of your partners' deliverables for their funding. I think another challenge can be when you're working on something with one of your partners and you think you're going to continue with this work, and they're like, we're done. We don't have time for this anymore, and something that's still your priority may not continue to be your priority. And again, communication and, making sure everybody's clear from the start what the expectations are can definitely help that. But, sometimes priorities change, or like we said, funding changes or whatever. So you just have to work through that communication and mutual respect and, all of those standard partnership kinds of things.
Yeah, and I think keeping your sense of humor, I'm a big believer in taking my job very seriously, but not taking myself very seriously. If that makes sense. I just think it's important for people, for this work to be fun. I want younger public health folks to know that this is fun work. I can look back over time and think, hey, I had something to do with that. I had something to do with that policy or that law, that law getting passed. Back in the day when I could have a lobby, I can't do it now. But having the sense of accomplishment of how much progress we've made, even just in Tennessee in the past 10 years of all the things we've worked on, and so it's a very exciting field, and I think we should have fun doing it. And I think if your partners feel that from you, they're going to want to be around you and they're going to want to work with you. And, yes, we take things very serious. And when it's time, you're very serious, but there's also time for levity and showing that this work can be fun and we can have a good time.
One thing that's a big challenge too is sometimes something's really close to what you need to be doing, but it's adjacent. It will pull you into a different direction. If you think of, like, I don't know who's all had training in causal loop diagrams, but it might end up like completely derailing you. So it's really important to really understand what would be the impact of putting your resources and efforts into that instead of what you've already started working on. Would it stop you from doing something that you want to finish? And so sometimes it's the hardest part of work, and big challenge is saying that's not a good fit for us right now. And then connecting them to a better partner. And then there are so many times that the requirement is that the Title V agency has to be involved. So we really have to figure out, and we don't want to keep people from being able to get funding either. So we don't want to be a gatekeeper to them having access to funding. So it's finding that middle ground without derailing things that we already have in the works that have a good potential of saving lives, of preventing injury and death. So and the ones that we decided were a priority for us and with our partners, and keeping that at the forefront. It's just it can be very easy to like chase the next thing and or spread yourself too thin. So just like Terry was saying, you made me think of that. But trying to stay aligned. We have this tool that we use every time there's a new partnership or a new funding opportunity that we have to fill out to see how aligned it is with what we're supposed to do. And then we have to present it to our senior management team, and it helps keep us in check. And we have to say whether or not there's like matching funds required, how long this is good, who do you need to partner with, how much business unit support do you need, things like that, so that we all know whether or not this would really tap a lot of resources for, and whether the juice is worth the squeeze, as our director likes to say. So
That's really interesting, Becky. And I'm going to circle back to that right after this next question. We're going to get into some frameworks and resources that you all are using. But before that, I'm going to ask you if you could share more about how your team identifies new partners or organizations to invite for Title V funding opportunities.
For me, it's really trying to be aware of what are the new issues that we're seeing come up and how are folks trying to address them. An example is I recently saw through social media that there was an organization that is really advancing a medical home model in our state, in a particular city, and has mental health services, substance use disorder, a food pantry, and they were asking for funding to help launch a clinic to offer well woman visits. And I'm like, all of this like beautifully aligns with what Title V is supposed to be about. So like I just reached out to that individual and I was like, hey, can we sit down and have a conversation? Like I want to learn more about your work. I feel like what you're doing is really innovative, really something that I would like to see, Title V invest in. Also really looking to our already partnerships that we have in place to say, like, who are you working with? Who are you seeing doing really great work in your communities that we need to be more involved with? And so just really trying to look for those opportunities to engage with folks that are on the ground doing the work in a way that is impactful for them, and just expanding even my understanding of, yes, traditionally we have worked with local health departments, but are there other programs out there that make sense for us to invest in that maybe aren't in necessarily the healthcare field that we would traditionally link with Title V? Maybe they're doing more of the social determinants of health work, which is just as important as increasing access to care.
Thank you. That's great. So I'd like to get back to that question about some resources. What resources and frameworks do you recommend for other Title V agencies working to establish and leverage partnerships? Whether these be some frameworks in the literature that you use, or if it's something that you have designed within your own Title V agency.
I will say in Title V, like this past year, they've really been pushing the framework for action. It's for children and youth with special health care needs, and that's where it's trained, but it is about building partnerships with people, and that can be applied across systems. And if you're building partnerships and working towards helping people with special health care needs, you're helping everyone. So I would definitely, the framework to action is a really strong tool and framework for partnership development.
Well, obviously, Jennifer, I would say attend Child Safety Network trainings and utilize their resources on their web pages as frameworks and some of the stuff you've already mentioned. Frameworks are great and they do get you started if you're, and they do help you track things, and I love what you shared earlier, and Becky's dead on with the stuff she's been sharing. But they only get you so far, right? So you have to have the courage to pick up the phone, like Jennifer said. Pick up the phone and call that stranger, or go to that meeting, or ask to be invited to go to that strange meeting you've never been to before. And I have some real concerns with the fact that we're mostly virtual these days. And how do you get to know somebody virtually in one of these meetings that we all are having? And I do attend face-to-face meetings as well, but I think that's another thing that we haven't touched on yet, and especially for younger professionals who don't have those kind of parking lot meetings and those lunch meetings where they can talk and get to know people and build relationship, and outside of the official presentation, ask those questions. I would encourage folks, if they're not doing that, to make sure they don't forget that. Somehow get to some in-person meetings and/or find ways to be intentional. To can't use the frameworks if you don't have somebody that you're trying to put into a framework. So, trying to get those, your list of folks and be very intentional about it. There's nothing wrong. And there's nothing wrong with being ambitious and wanting to be involved in a leadership group or wanting to take a leadership role. That's the other thing I want to reward is ambition. And, heck, run for office, not office, but run for a position on a coalition or a board or, volunteer to put yourself out there. Don't be afraid to do that if you're not already. And that gets you noticed and gives you more things to offer others when you reach out to them. But so those are kind of things that not necessarily frameworks, but just those kind of leadership skills. And then the last thing I'll say, and I'll be quiet, is just try to model the way. Try to be the partner you want to be, right, or you want to have. And I'm not perfect. I don't want to get the impression that I'm sure somebody will say, "Well, Terry, you forgot to call me back." I'm sure I did because I got too many other things going on. But try to be a good partner when you're asked, and that way, so you can when tables are turned and you need something, people are more likely to help you. And we've said that before, but modeling the way is probably one of the key points of being a good partner and getting good partners.
Wonderful. Well, we're almost toward the end of our time, and we have a couple more slides for you, but I first just want to really thank all of these presenters. You've really put forward how important not only management and tools and frameworks, but real leadership and people skills are to this work. Knowing your values, being really committed to not only achieving your vision, but knowing your partner's vision and helping everyone get there together. I really appreciate your spirit and the motivation that you talked about and the courage, especially when you're in a period of time where things can be more challenging. How you persevere and continue to inspire others, I believe, is critical. And you've all spoken to that so well today. Thank you. So Jenny, maybe we can move forward to our final slides. Thank you. Okay, so a couple more resources for you on this next slide here. We're gonna I won't read this all out loud because what I will share is that when we archive this webinar, we're also going to have an addendum that will include these resources, but other resources on partnerships for you that I hope all of you will explore and that will be valuable to you in your work going forward. We'll be including resources from a number of different partner organizations in injury and violence prevention and in public health. One that I want to call particular attention to today, this resource was developed by the Children's Safety Network Alliance, and this one provides Title V agencies with information on nationally focused public health organizations that all work to advance child safety. You'll be able to access a brief description of each of these organizations and the child safety topics that they're working in, the activities that they work on, and this may provide some ideas and opportunities for you as you think about the type of partnerships and collaborations that you would like to pursue. I also want to note that we have another cohort of our Child Safety Learning Collaborative coming up. We've extended our deadline. Our presenters have participated in our Child Safety Learning Collaborative. It's been invaluable to hear from them and have them share their resources across the nation, state to state. The aim of the Child Safety Learning Collaborative is to reduce fatal and serious injuries among infants, children, and youth. And you can see we do it through an all teach, all learn model. It's a quality improvement approach. And we would love to have you join us. The QR code is here. If you're interested, please check it out. Thank you so much. We are on social media as well. Please look at our website. Feel free to send questions. You can send them to the Children's Safety Network, and I'll make sure we get those over to our presenters if anyone has any lasting questions. Thank you, everybody, for your time today. Thank you to our presenters. Be well.